Welcome to this explainer on infectious disease surveillance. Now, if you're a medical student, you already know this is a critical topic, not just for your exams, but for your future practice. So let's break down the essentials into a clear, practical guide.
Here's our game plan. First, we'll nail down the definition of surveillance. Then, we'll walk through the cycle it follows. After that, we'll get into the nitty-gritty of collecting quality data, figure out how we analyze it, and finally, see how all of this leads to real-world action. Okay, first things first, let's make sure we're all on the same page. What do we really mean when we talk about surveillance in a healthcare setting?
Before I just throw the official definition up on the screen, take a second and think about it. In a hospital, what does that word surveillance actually mean to you? Because I can tell you it's so much more than just watching. And here it is, the official CDC definition. The two words you really want to lock in on are ongoing and systematic. Right away, that tells you this isn't a one-and-done project. It's a continuous, structured process. And the ultimate goal? To get that information into the hands of people who can use it to make a real difference for patients.
So how does that definition actually look in practice? Well, it's not a straight line from point A to point B. It's a dynamic cycle. Think of this cycle as your mental model for surveillance. It kicks off with planning, then moves into collecting and analyzing data. But, and this is so important, it doesn't stop there. That information gets shared, which leads to an evaluation, and that evaluation feeds right back into the next round of planning. It's a constant loop of improvement. Now, you can have the most amazing plan in the world, but the entire cycle hinges on one single thing: the quality of the data you collect. You've heard the saying, garbage in, garbage out, right? Well, it absolutely applies here. There are basically two main ways to gather data. Passive surveillance is what you see most often. It's using existing data from patient records. It's less work, sure, but it's easy to miss things. On the flip side, you've got active surveillance. This is when a team literally goes out and hunts for cases. It's way more accurate, and it's perfect for things like outbreak investigations, but it's also much more demanding on your resources. So it seems pretty straightforward, but what are some of the common things that can trip you up and completely compromise your data? Well, a whole bunch of things can undermine your data. You might be dealing with incomplete records, or maybe different departments are using totally different definitions for the same condition. You might have poor lab support, or the people collecting the data just haven't been trained well. Any one of these can give you a picture that just doesn't reflect reality. Okay, so let's say you've got your data and you're confident it's good quality. The next step is analysis. This is where we turn all those raw numbers into insights we can actually use. Two of the most fundamental metrics you'll ever use are incidence and prevalence. And it is so important not to mix them up. Incidence is all about new cases. It measures the risk of getting a disease. Prevalence, on the other hand, is a snapshot of all existing cases at one point in time. It measures the total burden. So as a clinician, you'd use incidence to see if a new prevention strategy is working, but you'd use prevalence to plan for how many resources you'll need for patients. And this brings us to the final and, frankly, the most important step of all. We don't just collect data to create pretty reports. We do it to drive action and improve patient outcomes. Let's look at a real-world scenario. Imagine an infection control committee is reviewing its data, and they find something that makes their hearts stop: a super high rate of infections after surgery. The data is practically screaming that there's a problem. So what do they do next? They took direct, data-driven action. First, they started monitoring key preventative steps, like the timing of antibiotics before surgery. Then, they gave specific, confidential feedback to the physicians involved. And the result? Infection rates dropped. Compliance with best practices shot up. It actually worked. And this is the key takeaway. Effective surveillance is not just a passive accounting exercise. It is the engine for improvement. It gives you the evidence you need to make changes, it shows you whether those changes are actually working, and at the end of the day, it protects patients. You know, this quote from Lord Kelvin just perfectly captures the whole philosophy behind surveillance. It's the foundation of quality improvement in healthcare. So as you continue your studies and you move into practice, always be asking yourself, what are we measuring, and how can we use that data to provide better care for our patients?